Good morning. So I bring you greetings from Government Medical College Thrissur, of which I am one of the faculty here. I hope you enjoy your one-day CME here. I'm sure you're meeting a lot of your friends here today. I hope you enjoy thoroughly, and I hope you take back a few points from today's CME. If you have any doubts on this session, please feel free to ask at the end of the session. When Baburaj sir asked about those of you who didn't know Malayalam, I saw only a very few hands. Can you please raise your hands, those of you who don't know Malayalam? Oh, okay, there's quite a few. So I'll stick to English. Sometimes the disinterest in the topic comes when you do not understand what is being said. So I hope all of you understand English. Is there anybody who does not understand English? Okay, fine. So we'll stick to English. So my topic today is reducing medication error. So what exactly is medication error? All of you are people who deal with drugs. There is not a single person here or a single anesthesia technician or a student who does not deal with loading a drug or bringing a drug from the place which is issued to the OT, isn't it? Is there anybody who has not dealt with drugs till now? So that is the relevance here. So what is this medication error? You need to know what that is to prevent it, isn't it? So what is it? It is any preventable event that may cause or lead to an inappropriate medication use or patient harm while in the control of, please note the next word, healthcare professional, which you are, patient or the consumer. This may be defined as a medication error. So why is this relevant to us? Are we doing lots of errors giving medications? It is very relevant. Why? Because medication error accounts for almost 1/3 of medical errors that occur. And in the US, medication errors cost 1 death out of 131 OP patients and 1 death out of 854 inpatient deaths. Why do we not have a statistics in India? It's because the documentation as well as the reporting from our parts is very less. Won't you agree with me? Sometimes if there is a medication error, we hesitate to tell even the seniors who are there in that particular OT. Hushing up is our problem. But please do not do that. So there are a lot of categories of medication error. Can you see this? It is categorized from A to I. And I stands for an error which occurred that caused patient death. So medication error goes in different ways. It starts from circumstances or events that have the capacity to cause error. That is just the circumstance itself. That itself also has to be reported. So it is multiple steps, multiple categories are there, and I am sure, I'm 100% sure that all of us have fallen into at least one of these categories. So what are the factors contributing to medication error? Of course, the most important one is human factors. We are the ones who deal with medications, and we are the ones who are going to cause the maximum amount of error. So one is from the healthcare provider, or it can be from the patient side. So what are the factors from the healthcare provider? Of course, if you are overworked or stressed, or you are distracted by talking with each other, or maybe watching your mobile phone, or looking at what the other person is doing in the other OT. These are things that can distract you, where you may automatically load a drug from an ampule which you don't read the label of, or you assume by just looking at one part of it, assume and you load. So, and of course, there is if you're sick, you are on antihistamines. Sometimes it will clog your judgment. So those kind of scenarios also can lead to error from your part. What else? Drug addiction is on the rise among healthcare professionals. You must have read in some of the papers, addiction is there. Now, addicts keep to themselves, they are very aloof, but there are lots of methods and signs which can pick these people up. So, the supervisors who are there in the OT should make sure to identify such people and keep them away. And of course, professional rivalry. When we were postgraduates, our sirs used to say, please beware of professional rivalry, where sometimes in the midazolam vial, if there is a person, if you're doing very well, sometimes there has been a history where the previous anesthesiologist loaded scoline in the midazolam vial and kept it. So the next anesthesiologist came, thinking it is midazolam, loaded the midazolam and gave it to the patient. What happened? Patient went into apnea and died. So certain things like professional rivalry, which of course the mental health of people are what is important, and how you're brought up is what is important there. So professional rivalry is one of the factors. So whenever you're taking a drug and you are new to an OT, make sure that you take only new vials and new ampules. Then of course, patient-related factors like communication error, I'll go into detail later. The low literacy rate on the part of patients. You will be finding lots of patients from places where, remote areas where they're not very literate, and they are coming for the first time to the hospital. They do not know what is happening here. So those are low literacy patients who may not understand what you have told them. Now, what is it important to us for? Because we go for post-op analgesia, where sometimes there will be patient-controlled analgesia being given by syringe pumps and things like that. So make sure that the literacy level and the understanding on the part of the patient and the bystander is good. Then of course, mistakes by the caregiver and hurried administration also by the patient. They'll be just popping up tablets. You must have prescribed an analgesic, and they'll be popping the tablet in without knowing. It might be an antihypertensive or an anti-diabetic, which they will be re-administering to themselves. Then of course, system-related factors like lack of communication, your supervisor who is inefficient, a disorganized workspace, poor workflow, inadequate tools to complete work. I'll go into the detail later. And of course, medication-related errors like LASA drugs, multiple dosages and strengths available for the same drug, like lignocaine 2% is available with preservative, without preservative. You have bupivacaine in different percentages. So if you do not read your label properly, instead of giving 0.25% bupivacaine, you will be administering 0.5% bupivacaine, may lead to local anesthetic systemic toxicity. And of course, prescribing errors, dispensing errors, documentation errors, transcription errors, and administration errors, and indent errors. So you can never rise higher than your expectations of yourself. So please expect the best. Why I introduce this is, my topic for today is reducing medication errors. But I would like to reinvent the topic as preventing medication errors, because it is not reduction that we should aim at. We should aim at preventing medication errors. Only then medication errors will totally be abolished. So what is this? Let's talk about the human factors. All of you may be doing double duty, or you may be overworked. You may not be used to your stressful environment. You may be new to it. You may take time to get adjusted to it. So your stressful environment is something that should be overcome. So what do you need? You need to sleep well. You should be well rested. That doesn't mean that you should sleep for 10 hours and then only come and then say, I will not do my duty, I am not rested and all that. Within your working hours, everybody has adequate working hours which have been prescribed by WHO, and you should be within those working hours. You should be healthy. What else? Why do we always hurry? We get up late. We do not have time for breakfast. We run and rush to the OT. We take some drugs and something and we just run around. So what happens there? There is a huge margin of error. So for that, what should you do? You should be on time. And you should be systematic in your daily routine. Being healthcare providers, we are responsible to the patient. The patient comes to the hospital trusting that they will get good services from us. So always you are supposed to give good services to the patient. That is why you should be on time, so that you prevent hurry and mistakes due to that. Then of course, what else? Your main role is what? A well-prepared OT is what is important. You have to keep everything ready that would be required for the patient as well as for emergency problems that may arise, like a crash cart, emergency drugs, etc. A pilot in a plane, do you think he's going to go look for the switches after he gets in the plane and starts flying? No, he will be well prepared, he will know where everything is, and he is well organized. In the same way, anesthesiologists can be compared to airplane pilots, and anesthesia technicians are their left-hand wingman. So you should also be well prepared, and the OT should be well prepared and organized and keep all your drugs and equipments ready. If you have any doubts, do not have any ego, don't feel bad, don't hesitate to ask for help. What else? You are learning now. Most of you are students here. You will be learning pharmacology. You will forget it as soon as you pass the exam, after written exam. That is not what you should do. You should keep revising the doses. You should keep revising your adverse effects and keep revising your knowledge. A knowledgeable person will prevent errors. And keep updating with the new drugs that are coming out. Update your knowledge. Don't say, it was not there during my study time, so I'm not. So dexmedetomidine was a new drug that was introduced. So everything, these new drugs, lots of drugs will come out in later years. So you should update and keep yourselves updated. And be happy, be friendly with your colleagues. Sometimes, in our OT, there are two batches of students and one set of bonded people. Sometimes there will be disharmony among the batches. They will be fighting among themselves. They will be having all kinds of silly problems among themselves. And you listen to it, you will find it very silly. And they will be fighting. So what do? They don't talk with each other. They come to the OT, they will be standing back to back. What is the problem for us? These people who are not talking with each other, we will not get what is required for the particular patient. So please be happy and enjoy yourselves in the OT. Please be stress-free in the OT by having a good cordial relationship with your colleagues. What about the next thing? Patient-related factors. Like I told you, people will be coming from places where they are not knowledgeable. So communicate with them. In the post-op period also, you will be telling the bystander sometimes, please look at this patient and let me know if there is some restlessness. Communicate properly with these people in the language that they understand. What else? A good, knowledgeable caregiver is there. You have a choice between two people. Please pick the one who is knowledgeable and ask him to stay behind to look after the patient. Take time to explain and make them repeat. Explain, and how do you know that they know that they have understood what you have told them? You ask them to repeat to you. Even when you're taking consent, sometimes they'll be standing blank there. You'll be telling them you'll have a heart attack, you'll have respiratory depression, all those things you'll be telling them. Finally, they'll say, there's nothing else. No, there's only so much. What does that mean? They have not understood the gravity of what you were telling them. So make sure that they repeat in their own words as to what you have told them. And if required, give written instructions clearly. Now coming to system-related factors. Like I told you, not only good communication between your friends, you should communicate with your superiors as well as the doctors. Like Baburat sir already said, if there is an adverse reaction taking place, sometimes it may not come to our knowledge. Bradycardia, sometimes we may be looking somewhere else. You are also the eyes of the OT. You are our eyes. You are our extension. So you also have to be alert and monitor throughout. And in case something like this happens, don't feel shy and say, Ayo, if I say that what they're doing is wrong or what drug dose they're giving is wrong, will they feel bad? No, it is up to you to speak up and tell them, sir, isn't this the drug dose that should be given? You can politely say. It is up to you to say that. So speak up and point out mistakes or point out problems. That is totally up to you too. And of course, what is the most important thing? One more. You should have an efficient supervisor, bar teacher, or whoever is in charge of the OT to guide you. You should be able to communicate properly with them. If there is a person who is very tough and you are scared to approach them, what will happen? You will not say anything. So things will not run smoothly. So always you should have a good, efficient supervisor. And what else? An organized, well-organized workspace. How many of you have drug trolleys in your OT? On the side, please raise your hands. Dedicated drug trolleys. Okay. So the rest of you, please go back and tell your administration, if possible, to keep a drug trolley which is well arranged. One more thing that you should know is, each OT in a particular hospital complex should have the same way of arranging. If atropine is in the front, atropine should be front of the drug trolley in all the OTs, so that you get familiar with it. What else? A good workflow. What do you mean by that? In our hospital, most of the time what happens is, you tell them, Ayo, take atropine and come. Even atropine is over. You will find 3 OT technician students running, all of them will be running to take that atropine. Finally, there will be nobody in the OT. So what happens? You tell them, go take this propofol. All of them will be running to take propofol. So what do you need there? One person should go. You should have told earlier in the beginning of the OT itself that this person is going to be in charge of drugs today, and that person is going to look for these drugs. NORAD, all of you run. Syringe pump, all will run. So instead of that, one person goes, the rest will remain. So there should be a good workflow in your hospital. And then of course, what else? To load the right drugs, you require the right tools, like the syringe pumps as well as the correct dosing of your syringes. Now, what else is the commonest cause of medication error? These are the LASA drugs. What does LASA stand for? Look alike, sound alike drugs. Can you see here? You have phenylephrine and neostigmine both looking the same. Ephedrine, adrenaline, both in the same vials. Here, this is from our OT. Earlier on, we used to have glycopyrrolate in total green. Now we have atropine in total green. If we are used to taking a green ampule for atropine without glycopyrrolate without loading, reading the label, we'll end up in trouble. Can you see here? We have ondansetron and NORAD, which almost looks alike. So if you are in a hurry to take NORAD, you may be giving ondansetron. If you are taking ondansetron, you may be giving NORAD instead. See how bad it's going to be. Then you can see here we have pethidine and fentanyl, again from our OT. Adrenaline and atropine, same, almost same ampules. Then of course sound alike drugs. Here you have Medzol, both of them are Medzol. One is midazolam, the other one is pantoprazole. So what will happen? Again, you will end up in trouble. So what do you do here? In such situations, actually we can write to the drugs controller and tell them that these drugs, which are totally poles apart, are packaged in the similar manner, and that should be changed. Can you see this? Can you read anything that is written on that prescription? Can you read anything? Now, in the post-op ICU, you are posted. We write something like this in the post-op orders and give it to you for giving. Will you be, if it is in this manner, will you be able to give it? So, you have to make sure that whatever is written legibly, otherwise go and ask what is written. Avoid irrational drug combinations. If there are any drug allergies, before giving a drug, even if you are asked to administer a drug, technicians may sometimes be asked to administer a drug, like propofol. If the patient is having an egg allergy, make sure that before you give that, or before the patient is taken in, you also check and ask them, do you have any drug or food allergies? And do not use abbreviations like ADR for adrenaline, ATR for atropine, ATR for atracurium. So don't use short forms, because atropine, atracurium, all those may have the same short forms. Write complete names. And of course, there were 12 points that were given, but there are more points here. What is the next one? Whenever you take an ampule, Whenever you take a vial, make sure that you read the label, and only after reading and rereading and finding out when the expiry date is, only then you draw the drug. And ampule should be legibly labeled and color coded following agreed standards. Syringes also should be legibly labeled. Then of course, dangerous drugs should be removed from the operation room. And like I told you earlier, your workspace should be well organized and well arranged, well marked also. And labels should be checked specifically by a second person also. So if in case somebody comes and says you gave the wrong drug, you can say, I made this person also check. We made sure that it was glycopyrrolate and then only gave the drug. And in case an error occurs, like I told you before, make sure that you report it and the error is reviewed, and make sure that everybody knows that such an error has occurred so that it is not repeated any further. And what is being now prescribed is that pre-filled syringes of drugs should be used to prevent such kind of medication error. And whoever is giving the drug should drop the drug by himself, load the drug. Color coding by class using labels, red for non-depolarizing as well as depolarizing muscle relaxants. Some color coded labels are readily available, pre-color coded. You can use those to label your syringes. And keep them in a position, like every OT will have a position where you will have pre-medicant drugs on one side, or maybe in the middle, induction agents on another side. So keep that coding in all OTs so that there is no mixing of drugs when you take it. Once the drug has left the ampule or vial, all will look the same in a 5cc, 10cc and 2cc syringe. So all will look the same, most of them are colorless. So make sure that the positioning also is very well adhered to in your particular institution, whatever you follow. So the right drug in the right dose at the right time by the right route for the right patient should be administered. Check and recheck before administering. Document correctly, and while copying from one case sheet to another, make sure that it is corrected, written well. And indenting from the store should be done properly, and drugs should be verified after they are indented. So how do you manage medication errors? Early identification of the error, notify your seniors and call for help, monitor the vitals of the patient, administer oxygen if required, and if adverse reactions set in, manage the symptoms. If the patient goes in for cardiac arrest, what do? You start your BLS or ACLS protocol, and the most important of this is an audit of these adverse events. That is, it should be reported and documented. To err is human. To persist in error is diabolical. So it is up to us to, in case we have erred, to correct ourselves and do better in the future. Thank you very much.